Think about the last time you had an infection, and you went to a doctor. You got antibiotics. Now imagine that moment without the doctor, without the antibiotics. Every single time someone got infected, here's what we get wrong about ancient medicine. There was observation, careful, repeated observation. The Egyptians didn't just treat illness, they documented it. The Ebers Papyrus contains detailed descriptions of illnesses. For infections, Egyptian physicians prescribed poultices using honey. Honey actually works against infection. The Egyptians weren't ignoring this. They were documenting it across thousands of people. Hippocrates argued that illness was a natural phenomenon, but the specific theory, the four humors, was wrong. You have a fever, you're hot, so you need to cool down. You bleed the patient to remove excess hot blood. Greek physicians prescribed specific plants and herbs, recommended exercise, diet adjustment, rest. Roman military surgeons developed sophisticated techniques for wound management. A wounded soldier who healed was a trained resource. Roman military medicine was remarkably advanced because the Roman army depended on it. Organized hospital facilities. Roman physicians prescribed a huge array of herbal remedies: willow bark, ginger, garlic, and various plant resins. Medieval herbalism was genuinely sophisticated. Monasteries maintained herb gardens specifically for medicine. The rise of the apothecary. These were specialized healers who focused on preparing medicines. Medieval birth attendants, mostly women, developed practical knowledge about childbirth. More mothers and babies survived. If you want to go even deeper into how ancient humans approached illness, I just launched a comprehensive course. Traditional Chinese medicine operated on a completely different framework: acupuncture, herbal medicine, diet, and movement practices. Herbal formulas for managing pain, reducing inflammation, regulating the cycle, refined across centuries. Chinese medicine, refined formulas, documented, refined across medical lineages. Designed specifically to regulate the menstrual cycle. Indigenous peoples across every continent developed sophisticated medical knowledge. Amazon, Africa, North America developed knowledge of hundreds of medicinal plants. Indigenous healers' recommendations correlate with actual bioactive compounds in the plants. The accuracy rate is too high to be chance. Indigenous knowledge survived through apprenticeship and community practice, transmitted through generations with enough precision. You treat someone with a plant. They get better or they don't. If enough people get better after receiving the same treatment, you repeat it. Those things survive in the oral tradition. Those things get passed on, refined across centuries until what started as trial and error became standard practice. It takes time. It requires large populations. Most of it fails. But some things work. Those things survive, become standard treatment. It means ancient humans, working from premises we now know to be false, arrived at treatment strategies that actually worked. They didn't understand why it worked, but it worked. Chinese medicine's theory of qi is not how the body actually works. Yet acupuncture works. Treatments are effective for reasons that don't match the stated mechanism. A lot of ancient medical knowledge has been lost. A medieval healer who spent 40 years learning died, and that specific knowledge died with them. We're left with a strange situation. We have better medicine than the ancients, but we've gained understanding. We sometimes forget that not understanding the mechanism doesn't mean the treatment is useless. Everything we've built, medically speaking, is downstream of that ancient empiricism. The ancient healer sitting with a patient, applying what generations of healers before them had learned, wasn't practicing superstition. They were practicing medicine. You see medicine, everything we've built is downstream of that ancient empiricism. They figured it out first without any of the tools we take for granted.